With a traumatic brain injury or TBI, we have a disruption in brain functioning due to a trauma. And this trauma causes a primary injury, which can include shearing, destruction of brain tissue, and/or hemorrhaging. And this primary injury causes these reactive processes to happen in the body, which results in a secondary injury, which further damages brain tissue. So these reactive processes can include hypotension, hypoxia, ischemia, as well as cerebral edema. And those things will cause more damage to the brain tissue. So in terms of the signs and symptoms of a TBI, the signs and symptoms are mostly related to an increase in intracranial pressure. And they include a decrease in level of consciousness, something called Cushing's triad. So with a triad, we have three things. So those three things are systolic hypertension, bradycardia, and irregular breathing. Other symptoms of a TBI include confusion, headache, pupil abnormalities, nausea and vomiting, seizures, as well as abnormal posturing. Diagnosis can be done using an MRI or CT. And then in terms of treatment, medications such as mannitol can be used to decrease intracranial pressure. In addition, hypertonic saline can be used, which helps to draw fluid into the intravascular space, which helps to decrease swelling in the brain tissue. We would also use pentobarbital to help induce a coma in the patient, which decreases their metabolic demands. We would also use anticonvulsants to help treat or prevent seizures, as well as opioid analgesics. In terms of procedures, mechanical ventilation and ICP monitoring may be necessary, as well as a craniectomy. Now let's talk about some complications that can occur following a TBI. One such complication is brain herniation. This is where we have the downward movement of brain tissue that occurs due to cerebral edema. Signs and symptoms include fixed and/or dilated pupils, a decrease in level of consciousness, abnormal respirations, and abnormal posturing. Other complications include the formation of a hematoma or hemorrhaging. So the patient can have an epidural hematoma. This is where we have arterial bleeding between the skull and the dura mater. Or we can have a subdural hematoma. This is where we have venous bleeding between the dura mater and the arachnoid mater. Or we can have intercerebral hemorrhaging, which is where we have the accumulation of blood within the brain tissue.